We are now on to our last speaker of the evening before we go to our break. And the next speaker is Innovation and Business Development Manager at Min Doktor, Sweden's first digital caregiver. He has a background as business architect and is also a former Armed Forces technical officer and worked within the management consulting industry before joining Min Doktor. Daniel Persson will explore Untact medical services and their use during COVID-19. Ladies and gentlemen, it's a great pleasure to introduce Daniel Persson. Can you hear us, Daniel?
Yes, I can hear you, and I hope you can hear me as well.
Most certainly.
First of all, thank you so much for having the opportunity to be here. I'm really glad and looking forward to it. I also think it's really interesting to see that the similarities we have within the healthcare systems is quite, of course, similar. How we are approaching them will probably vary a lot, but I will give you some context of how it's been being a provider, and of course with a clear digital focus during this crisis. So if we look at the company timeline, we are a quite young company. We were founded 6 years ago by a friend and colleague of mine. He's a doctor and entrepreneur. He had a vision that a lot of his patient meetings, they were not used to actually being done in the physical premises. So he had this vision, and he looked into other sectors that have either been doing the digital transformation for quite a while or started, and he looked at the bank. But the bank sector in Sweden is highly digitalized. And it has been a transformation where you were used to go to the bank office to either look at your accountant or pay your bills and such. And now we're doing most of those kinds of tasks or activities online. So that was his vision of how can we create this. And the last 6 years has been a fantastic journey. We have had an enormous growth in the number of digital patients or visits, of course, and we have went from being an early entrepreneurial company to a company that now has 400 employees. We're providing services both online and offline, and I would say that we're one of the largest, if we look into number of visits, providers within the primary care sector in Sweden. And I'm not sure if everyone is aware, in Sweden we have a blended model where both private providers and also public providers can provide the services, the medical services. So if we go to the next slide, I will just give you a brief introduction about the Min Doktor concept of the model. As you probably know, since looking into the bank sector, we don't use the video call as the primary driver or the core feature of the digital transformation. So before you actually meet any of our specialists within the service, you're answering questions on a computer-based interview. Those questions will then be presented for the professional, and we're converting them to a knowledge-based document. After that, we have a traditional consultation where the doctor can, of course, text, message you as an individual. You can have a video call or a telephone call, but we can also send our patients to other physical examinations. For example, if we need blood samples, we need x-rays and such, that is integrated in the platform. So we can act as a traditional provider, even if the discussion and the consultation is mostly done online. And if we go to the next slide, as we have talked about, of course, Sweden had the effect of the crisis as well. And this is just data from the public authority of the monthly digital visits being made by patients, I would say, done by the largest private providers in Sweden. And you can see that in March this year, we had a dramatic increase. And of course, that is due to the corona crisis. The effects were when the information was spreading around the country, of course, we saw a dramatic increase in need of both accessible and available services when it comes to questions. We also had the effect of locking down or restraining people from seeking care in the traditional primary care units. So they had nowhere to actually go to address concerns and questions. And of course, they turned digital quite soon. And being an entrepreneur working within the field of digitization and healthcare, of course, this is a dream for us, but it's also been, I would say, a challenge, because it's not only the ones that have adopted to the services that we have provided for a couple of years now. This also introduced different patient categories that we hadn't seen before. So if we look into the next slide, I have only pointed out three major dimensions or perspectives. When it comes to individuals or patients, as I said, we saw the introduction of new patient categories. Of course, we have the ones that always been adopting to using digital services. They were also dramatically increased. For example, those can be people with either skin diseases or possible skin diseases, rashes, common infections, sore throats, etc. Since that was a consequence of the COVID spread, yes, some of them turned digital as well. But we also noticed that people with chronic illnesses that we discussed or heard about earlier today, they couldn't meet their ordinary primary care unit or the specialized unit. So quite early in the phases of the crisis in Sweden, they turned to us digital providers. And of course, that increased the speed of our innovation. So we introduced a new subset of services. For example, when it comes to asthmatics, they weren't considered as a risk group initially, but of course, everyone with a severe asthma was quite anxious. How will this affect me in my life? So we partnered up with another company where we could provide a remote monitoring tool for people with asthma. And it's worked out really, really well. We can see in the data provided from these individuals that pretty soon they were back to their normal life routines. And they also knew that they had their caregiver in the pocket, so to speak. So it's just a quick call to initiate if you need to discuss anything when it comes to either medication or your everyday feeling. The third category is the starting aging population. We have seen a huge increase when it comes to the age 50 plus. And those have been a category that has been slow into adopting to new digital services. Of course, the development in general is driven by the younger population because we are more digital mature and we're used to consume services in our smartphone. But this crisis has actually been a driver for the adoption of the elderly population as well. When it comes to the professionals, we have a couple of hundred, but we have a huge public sector with a lot less digitalization maturity, but they have been forced to actually rapidly start both scaling and implementing different kinds of services. So today I would say that every one of the 21 Swedish region has their own setup of a similar service that we or other private providers can provide. Next area within this digitization, I would say, is the remote diagnostics, meaning that we have different kinds of accessories or wearables, new products that will actually help people or doctors being online to make complete diagnostics by individuals in a different geographic area. So one of those tools is provided by a company from Israel called Untitled, where we have teamed up. So it's a little device where you can actually listen to the lungs, so you can do a lung examination You can do a lot of different vital sign examinations in real time. So we have examples of the patient staying at home, having some kind of symptoms. We can either send that kind of device home to the patient, and then the doctor can make a very thorough examination. So it's all about mobility and how you can combine both digital services with new tools, as we've heard earlier before, to deliver healthcare in totally new ways. We also were quite successful when it comes to implementing self-administration for COVID-19 related testing in the public sector as well. From being a rather analog service earlier today, fortunately you can actually go online and order some kind of time when it's possible for you to make a test. And we have the possibility within the system to actually send test kits home to the individual, so you don't have to need to go to either the ER or the emergency room. We have also now mobile locations, so we can increase the accessibility and availability of these kinds of test stations throughout the country. So we've been, we tried, or we could scale up the test capacity quite soon. And I think that is due to the mind shift from the public sector's decision makers, that we need to scale, and we need to scale it fast. And then the digital tools are the only tool that can make that happen. And if we take the last slide, I'm really, really glad to hear that the discussion about how we're continuing the digitization within the healthcare sector. It's all about the objectives and not the means. In Sweden, we have a quite immature discussion sometimes where we think that video calls will be the main driver of digitalizing the healthcare sector. But of course, it's all about those objectives that we've heard been mentioned earlier: availability and accessibility. We need to increase quality, and we need to increase the capacity. And being data-driven in that development is the only way that we can understand that we are on the right path. And it's also, of course, about patient autonomy and equality. In Sweden, we have 21 different regions where we actually have an equality issue, meaning that depending on what kind of region you're a citizen in, you can have different services being provided by the healthcare sector. And also, when we are starting to become more data-driven when it comes to the development of the healthcare sector, then we can start preparing for being more proactive and, of course, use all the data in a more predictive way. So it was just a short brief and background what has been going on and being an entrepreneur in this field that's started to transform quite rapidly. So thank you.
Thank you very much, Daniel.